The Alzheimer's Association International Conference, this is the time of year they have it. It's now wrapping up, and as it does, there's always new breakthroughs, new things to learn, and still new things to address. Dr. Margarita Reyes is a geriatric medicine doctor from Bristol Health. She joins us this morning to tell us how we did this year. Good morning to you.
Good morning.
So let's talk about this. I mean, every year, and then we were talking before during the commercial about how as much as we know and as much as we learn, we're still kind of scratching the surface. But a new survey from a U.S. pointer came out. What did it tell us?
So it's a study looking at lifestyle interventions to protect brain health, reduce the risk of cognitive decline. They looked at 2,000 participants over the age of 60, and they randomized the people into two groups. One structured, meaning more supported, more frequent sessions, and the other self-guided.
All right, so results were impressive. We're going to put up on the screen now a couple of things that have been kind of like the trends to focus on, right?
Yes, so it showed that the structured group had more benefit. They performed about 2 years younger than their stated age, and they looked at 5 lifestyle interventions. First, the mind diet. Second, physical exercise. Third, cognitive exercise, meaning challenging your brain with something new. And fourth, they looked at social exercise. And lastly, they looked at monitoring blood pressure.
And this has been addressed a little bit before, that active folks who have been diagnosed with dementia of any sort kind of have, I don't want to say an edge, but kind of, have a better than the rest outcome, right?
Yes. Yeah. These people had higher cognitive reserves. So people who invested in their health early on definitely did better.
There you go. One of the things that the conference also addressed was women. 2/3 of those of women have, let me try that again. 2/3 of the folks that have been diagnosed with Alzheimer's, that sounds better, are women. And some new information has come out about that as well.
2 new things. First, it's that people with traumatic brain injury, women's brains were affected more, so more brain shrinkage in women. Second, there was a chemo brain study, and it showed inflammation and shrinkage in the same areas that are affected in dementia.
Is there a reason why? Is there a focus for doctors?
Focus for doctors looking at women? Well, it's precisely what you said. It's that 2/3 of all people with Alzheimer's disease and other dementias are women.
Interesting. All right, so where to from here?
From here, well, they're looking at these same patients for another 4 years, looking at the longer-term effects. And then, of course, it's about educating the community about the findings.
And as we've said countless times when we discuss Alzheimer's research here, it's not just the folks that have been diagnosed, it's the caregivers as well who should be studying this research as well, because they're the ones who have to interact and deal and adjust accordingly. Lots of information. It's at alz.org. We're going to link that to you on our website. That's fox61.com. There it is, alz.org/CT. Don't want to forget that. And there's a number you can call if you have any questions. Dr. Margarita Reyes, nice to see you. And always interesting with more information that's coming out. And we're just trying to get a grasp on how this thing works and how we can cure it.